millions of couples around the world struggle with the physical and emotional pain of trying to have a baby.
But now doctors in Massachusetts say they've developed a test that could help ease at least one major stress of in vitro fertilization. At the heart of it, spit. Our Allie Donnelly has the exclusive on the story. She joins us now to explain. Allie?
Well, LaToya and John, Boston IVF has developed a saliva test so women can just spit into a vial instead of having to go in for daily blood tests. No more needle pricks, no more Band-Aids. It might seem like a small thing, but when you're enduring all the injections, the mood swings from hormones, the anxiety of waiting to see if an embryo will take, one stress eliminated, patients say, can make all the difference.
Hey, cutie.
Huddled for tummy time with 4-month-old Beatrice, Nicole Noguera could never have imagined how hard it would be for her to have a baby.
It didn't even really cross my mind.
But the 33-year-old Norwell, Massachusetts woman and her husband Jake started trying more than 3 years ago. First naturally, then running the fertility gauntlet, arriving eventually at the doorstep of Boston IVF for in vitro fertilization.
I always felt like it was this part-time job that was so stressful, and I just dreaded it.
Trying to get pregnant consumed her. In 5 cycles of IVF, there were the shots, the hormones, the days off work for transfers, the rumor mill grinding when the Harvard social worker missed appointments or was late for meetings, the blood draws, and more blood draws.
Patients feel like pincushions because they're getting so many sticks. If you get one blood test for your annual visit to the doctor, that's okay. Everybody can tolerate that. But imagine yourself getting, 6 or 7 blood sticks within a few days. That's a whole different level of invasiveness.
Dr. Michael Alper heads Boston IVF, home of the first test tube baby in New England. Now he is announcing another first.
It's really simple.
Researchers at Boston IVF have developed a saliva test to replace the daily blood tests doctors use to monitor patients' hormone levels. Women can now spit into a container, seal it, and drop it off to be analyzed at Boston IVF's Waltham Center. You might say, what's the big deal? But to patients like Nicole, it's a very big deal. They say half of the battle of trying to have a baby is physical, the other half mental.
I do believe it could be more friendly if you had one less appointment. If you didn't have to wait that 20 minutes for the blood draw. I think you get less questions at work if you forget to take the Band-Aid off. There's a little bit more privacy.
Some studies have shown that the stress of infertility is greater than the stress after being diagnosed as having cancer.
Alper says stress is also one of the leading reasons patients stop doing IVF. The Nogueras took a 3-month break and could very well have dropped out entirely, but are so glad they didn't.
Hi.
Right now, the saliva test is available at Boston's IVF's Waltham clinic, but Dr. Alper says it should be at all of their New England clinics in a matter of weeks, and they hope to sell the test commercially, making it available to clinics across the country by the end of the year. LaToya?
Eye-opening story. Allie Donnelly, thank you.